So a very good evening, everyone. Those who are watching this video, I welcome you to this basic session of Oxygen Advantage. Oxygen Advantage is a program where I wanted to share with you the key aspects. And thank you very much, every one of you who has joined today. So we'll start with a little bit of presentation, understanding about the Oxygen Advantage. I'm Coach Rahul Sharma. I've been certified Oxygen Advantage trainer, as well as I'm a running coach. I've been a certified nutritionist and done a lot of cross training certification. So it's a real pleasure and honor to welcome each one of you for this wonderful session. So not taking much of your time, let me just get into the presentation, which I wanted to share with you. So I hope this presentation is available to all. So let's understand the basics of Oxygen Advantage. Now, before starting and understanding into any kind of a program, we need to also understand the very key aspect that, what is breathing, right? So when we talk about uh, what stays with us from the birth till the death, it is the breath. So from the early, when a person is in the womb, right? They don't breathe through the lungs, right? So when they get born, when the child is born, the first thing they do is, they take a first gasp of the air and lungs open up. Lungs get developed in the last couple of months of the pregnancy. They fully develop. That's why, in the premature child who birth, they always have some kind of a lung issues, right? And that's why breathe is something which we start with our first, when we enter into this earth and till we die, it is the breath which happens. And how much focus do we need to give to this breath, right? We think that this is an automatic system is there. We just keep on breathing in the way, and we always feel that it's a natural, but it's not the case, because when we talk about this, what changes when you experience a different set of emotions. Suppose, for example, if you are late for the work, you feel nervous, you feel a little bit stressed out, your breath changes, right? Similarly, any situation you can just imagine, you are very happy. What happens? Your breath changes. When you are very sad, what happens? Your heart sinks, your breath changes. So it is the breath which is the true indicator of your well-being, as well as of your uh, you know uh, true reflector of your body. Not only that, breathing always helps in bring the clarity and returns you to the present moment. So if you are able to breathe consciously, or if you are able to focus on your breath, and so it helps you in bringing the clarity. And by learning to navigate the breath, we can navigate our emotion in our life. And we are very fortunate that we all are born in India, where, from the time immemorial, yoga as a practice has been practiced by majority of the people. And with the recent advancement, there are, the entire Western world or the world over start looking into the advantage of yoga. And one of the key aspect of yoga is breathing. So they ask you to focus on the breath. So how is this program of Oxygen Advantage different from the yoga? Okay, so ultimately, whether it's a yoga or you take any program, uh, it's when you focus on your breath, you try to calm your mind, and you are uh, better able to navigate through your emotions and the life. So looking into that, what is the importance of fitness? When we speak about fitness being a state of health and well-being, and more specifically, it is the ability to perform the aspects of the sports, occupation, and the daily activity. So everyone need to be fit. We always say, what is fitness? So we always say that fitness is something which we are able to do the job which has been assigned to us without getting fatigued, too much fatigued. So moreover, if a person is fit, they can get protected against many chronic diseases like hypertension, cholesterol, diabetes, a lot of chronic diseases are the result or the outcome of a person being a non-fit person or not taking care of their body. It even helps to fight infection. And who better can tell this, because I myself suffered COVID twice and I've been able to beat the infection twice with the minimal side effects and with the minimal complications. So uh, once you are fit, you are able to beat the infections much more better than the common man who is not as fit. So aid in the weight management obviously lowers the blood pressure, improves your heart health, improves your quality of sleep, reduces the feeling of anxiety and depression, improves the joint pain and the stiffness, maintain the muscle strength and balance, and improves your memory and the brain functions, and therefore increase overall lifespan. So once you are fit, you can increase your overall lifespan. And one of the key aspects, there are two types of system in the body where there is a, you know, there is an automatic system and the other one is the system which is in our control. Like if you want to move from this place to other place, you just stand up, you give that instruction to your muscles and body to move, and then the body moves. But there are a lot of activities which are happening automatically, like your digestion. You eat the food, that's a mechanical part of it, but once it goes into it, it's an automatic digestion which is happening. Similarly, your heart, which is working automatically. You don't instruct your heart to beat, right? Similarly, is your breathing, that it gets into your automatic nervous system, or we call it as autonomic nervous system. And there are two parts of autonomic nervous system. One is a sympathetic and one is a parasympathetic nervous system. Now, we are not going to get into that details because we just wanted to understand this autonomic nervous system. We can also train this autonomic nervous system through our breathing exercises, through the various set of exercises. And one of the thing which we understand as the basics of oxygen advantage is how we can train these systems. Yoga is another way of training that autonomic nervous system. So when we move from the understand the importance of fitness, and I just wanted to put one slide on the COVID and the respiratory system, because this is what we are talking about, the lungs. So current pandemic of COVID-19 and its respiratory disease, which affect the entire respiratory tract, including lungs. Coronavirus infect the upper and the lower part of the respiratory tract, and that's why we have seen those people who have done for a high resolution CT scan. They found that there is a some sort of damage to the lungs. So around 14% of the COVID-19 patients are severe with an infection that affects both the lungs, and where the air sacs, which we call as alveolar, are filled with the mucus. Moreover, 5% of the total cases are critical, which requires an hospitalization, and where infection damages the wall and the lining of the air sacs and leading to various acute respiratory distress syndrome. So thereby healthy respiratory system and lungs aids in overall fight and recovery from such variety viruses and diseases. So how does this oxygen advantage program work? So this oxygen advantage program will help you in terms of building your immune system, building up your respiratory system for any kind of a work which you wanted to do, like a fitness. If you are into the sports, you need an endurance for the running, cycling, or swimming, or whatever sports you are in. It helps you in building up your system. More so over this oxygen advantage helps you in living life with the full potential. So just a question, how many of you think that taking large breaths during the rest will increase the oxygen content of the blood? I think most of the time we get this kind of an advice that, you just keep taking the large breaths whenever, and there are a lot of coaches which advise, take large breaths whenever you are feeling out of breath. See, this is a kind of a question, and most of the people says yes, right? Yes, it increases the oxygen content of the blood, but it is not the case, because in any case, whenever you measure your oxygen saturation, which is into the pulse oximeter, it is always around 98, 99. So if you take more larger breaths, this will not go to 100%, right? So there is no oxygen deficiency, right? And this taking large breath will not fulfill that. So what is the other factor? So the very important factor. Like most of us consider carbon dioxide as a waste gas, but it is not the case. Carbon dioxide is not a waste gas. It is a very important factor for which allows oxygen to get absorbed into the body, and that's where which is known as a Bohr's effect. So first of all, taking large breaths will not solve your oxygen content or increase the oxygen content in the blood. Research has shown that, like calorie restriction extend the lifespan, right? If you eat less, you live longer. But one nutrient we don't consider is an oxygen. Just as an excess calories can cause a metabolic damage, excess oxygen can also prematurely damages the tissue through generation of free radicals. Another well-documented research is that those who live at the higher altitude tend to live longer. So, आपने अगर कभी, you must have heard into the old movies, somebody get ill, they say that you take them to the uh, to, to the mountains or पहाड़ों में ले जाइए, right? So that they will get a fresh air and this, and they can tend to live longer. But one of the key aspect is that the oxygen concentration as you go up it decreases, and their bodies start getting adopted for the lower level of oxygen, and that's why they tend to take less and less of oxygen, and they less and less generation of free radicals and less metabolic damage. And that's why if you see the life expectancy or the lifetime of those who are living at the higher up are pretty large. So there are many reasons, and one of the explanation is definitely the reduced pressure of oxygen at the higher altitude. So when we understand this, breathing. So breathing is something we can live without food for weeks, water for few days, but for air, just few brief minutes. We can't live without an air. And this subconsciously, automatically we are doing again continuously, every day we are doing. We spend so much time and attention into what should we eat, what should we drink, what should we diet, but we don't practically give no attention to the air which we breathe. How much air do we need to breathe? Have we asked this question any time with us? How much quality? What is the quality? Maybe we are asking quality. Okay, this is not the right place because we are feeling some kind of air is not good or it's smelly air. So we move to that. But what about quantity? Do you think that you require the kind of air which you are taking, or is it more? Is it less? No, we don't answer that. We feel that it is all automatic system, and it body will take out whatever air is required in the air. It is not the case. Process of breathing has been warped by the chronic stress, sedentary lifestyle, unhealthy diet, homes, and the lack of fitness. Healthy breathing habits are the part of healthy living, because we are breathing continuously larger quantity of the air, so we don't recognize. Like for an example, if you start eating, instead of 4 chapatis you start eating 3 chapati, your body will get adjust to these 3 chapatis a day, right, in one meal. Or if you start from the 4, you can come down to 2 chapatis. Initially it will be a little pain, you will feel hungry, but slowly and gradually body get adjusted to these 2 chapatis a day, or in a particular meal. Similarly, if you start eating more, like for example, from 2 chapatis, you start eating 3 chapati. Slowly and gradually, body get adjusted to that 3 chapati. From 3 to 4, 4 to 5, whatever number you want, you can expand. The body get adjusted to that. Similarly, when we talk about breathing, the breathing get adjusted as per the requirement. So sometimes what's happening is that it is not that we require to take so many breaths in a minute, but we get adjusted. We are taking more and more breaths. So that's where we say it's a chronic overbreathing problem. And why this chronic overbreathing? The biggest obstacle to your health and fitness is the rarely identified, which is a chronic overbreathing. How many of you have looked into what is your breaths per minute? We always talk about in our training about heart rate, heart rate. Heart rate is a very good indicative marker of your health and the fitness, but more so it is about the breathing rate. Because why we increase the breathing? Because our body is not able to supply the required amount of oxygen to the working muscles. And that's why we breathe more. To breathe, when we breathe more, right, our heart beats more, correct, to supply that blood, extra blood, to the different parts of the body. So it is one of the very, very key and important marker which we need to work on in our body uh, is breath rates. So chronic overbreathing leads to the loss of health, poor fitness, compromised performance, and a compromised immunity, and many ailments including anxiety, asthma, fatigue, insomnia, heart problems, and even obesity. Right? So even just by the breathing, you can do a lot to your body, which is not possible when if you are not doing that breathing in the right manner. So this Oxygen Advantage program has been developed by Dr. Konstantin Potyako. He was a brilliant Russian physician who conducted a groundbreaking research into determine the optimal breathing for the astronaut. So, if you remember, during the Cold War or space war between the US and USSR, Dr. Konstantin Potyako worked on these techniques, and then these techniques has been further refined by the Patrick McCon, who is an Irish researcher who developed these techniques and refined the Butiaku techniques and created Oxygen Advantage program for optimal breathing. So by incorporating this program of Oxygen Advantage into your fitness regime, you can increase the oxygen delivery to every part of your body. For an individual, it's an advantage, and for an athlete, it's a competitive advantage. So how are we going to do into this Oxygen Advantage program? That's something which we need to identify. So the program of Oxygen Advantage increase the energy and focus, improves the resilience to reach your full potential. It's a kind of a functional breathing training which reduces breathlessness, improves the oxygen delivery, dilates your nose and lungs, improves the core strength, and sleep better to increase your energy. Sleep is a very important aspect, and if you breathe properly, you can sleep properly. So the Oxygen Advantage teaches you how to increase exercise intensity while expending less effort and breathing less heavily. It simulates the high altitude training to improve your aerobic and anaerobic capacity, improves energy levels, concentration, and the mental focus, and becomes fitter and stronger. So you'll feel the benefits of high altitude training, which is as high as 5,000 meters to 17,000 feet with just 1 week of practice. So that's something which is very, very important, to you to learn in this program. So overall, the Oxygen Advantage program has been designed to strengthen your respiratory system, improve oxygenation of the heart, reduces the lactic acid and the fatigue which you feel on a long runs or on long endurance activity, improves your overall health, reduces breathlessness during exercise, increases the oxygen carrying capacity in the delivery, improves the VO2 max, prevent the exercise-induced asthma, and improves your running economy and the sports performance. So one of the key aspects, now I want you to measure this. This is a board which is a body oxygen level test. What is at your level. You need to inhale, take a small silent breath in through your nose, and allow a small silent breath out through your nose. Hold your nose with your fingers to prevent air from entering your lungs, and count the number of the second until you feel the first distinct desire to breathe. Now the key point is you need to count the seconds. Or just say we have seen in this picture that your breath in, breath out, and after the hold, when you again breathe in, it should be the same breath as you are breathing normally. So you are not pushing too much. It is not about the maximum breath hold, like कि कितना हम breath को hold कर सकते हैं. It is not the test. It is that first distinct desire. And how do you find out that the first distinct desire to breathe in? That you will come to know when you do maybe your diaphragm or your stomach will crunch, or your body will give you a signal, it's time to breathe. So first distinct desire to breathe in, that's what you need to look into when you are measuring your Bolt or body oxygen level test. So this is a test which determines how much is your body at what level, right? And based upon this bold score, their individualized programs can be developed to build on those bold levels. So that's very important for you to know about how many seconds you can hold the breath. So we will understand that part. So you can do this test whenever you feel like. One of the key aspects which you need to learn is breathe light to breathe right. Now, uh, because we understand that we have a high chronic breathing problem, we need to learn about the breathe light to breathe right, right? And we need to bring it into our daily practice, maybe for 5 minutes, 10 minutes, 15 minutes, half an hour, 45 minutes a day, whenever you get time. You can do this exercise. I'm just teaching you this exercise. This is just a very basic exercise of the oxygen advantage. There are tens of 30, 40 exercises which you need to learn in the entire program of oxygen advantage. But this is the basic exercise which you can do to, start, being very conscious about your breathing and start breathing in a right manner. So what do we have to do, right? The objective of the breathe less is to breathe less than what we are breathing before we begin the exercise, and to create a tolerable need for air and sustain it over 3 to 5 minutes. So we can do it for the 3 minutes. At first, sometimes what happen is, so if you can see the chart here, you can see the amplitude and the rate. So this is how you are breathing: deep breathing in, out. But now you need to do a smaller inhalation. You have to reduce the amount of air which you are breathing in, and then also you need to work out and increase the time of a breathe out, right? So if you're breathing in for 4 seconds, you need to breathe out for 5 seconds. And then there is a a turf, or which we call it as a natural pause. So you need to give that a natural pause to your breathing. Just 1 second. So you need to practice this. You have a small, gentle, small breathing, right? Small breathing does not mean that you are not breathing deep. It is light, it is slow, and it is deep. Deep meaning thereby you're taking the air inside up to the lung, up to the diaphragm. And when you are breathing in, your stomach moves out, your chest expands. And when you are breathe out, when you are exhaling, your stomach goes in, your chest goes out. And that's how, you can feel about the oxygen advantage, or this is the basic exercise of breathe light to breathe right. So you can do breathe light to breathe right is slow down the speed of the air as it enters and leaves your nostril. Take a shorter breath in and allow a relaxed breath out. We can do that. 4 places where you should feel the air is through the nose, through the back of your throat, in the chest, and into the diaphragm. So it's a very deep breathing. It's not a shallow breathing at all. It's a breathe light to breathe right. So you can do that practice. You can do this practice for the 5 minutes. I will give you like, it should be like in, when I say in, it's a breathe in, 2, 3, 4, out, 5, 6, 7, 8, pause, right? So you can practice this out. There are a lot of apps which are available online, which, give you a measured breathing part. So you need to do that, right? You need to sit up straight. You have to put your hand on your chest, another hand on the stomach, and push that. You have to restrict, because sometimes what happens is we are taking the air because already from so many years we are breathing in the manner our body has adopted, our muscular structure has adopted for breathing in more and more air, which is not the correct case, right? So we need to put a little bit of pressure on the chest and to the hand, onto the stomach, so that we will breathe less and less with each breath, right? When you do this for 5 minutes, right, you will see that your eyes go glossy. There is an increased saliva in the mouth. Nose may run dry. The nose may run, or your hands get warm. Your face get pink. Some people feel sudden calmness. Other may feel slight panic. So there are a range of emotions which, so be an observant when you are doing this breathe light to breathe right, right? And you will feel a little bit great about it. Okay. Another thing which you can do, I'm just giving this as a is one of the exercise. Warm up with the small breath holds. Another thing which you can do is very simple. If you can see and observe, small breath in, just small. You breathe in, breathe out, and hold. Pinch your nose and hold for 5 seconds. Then again, breathe in, breathe out. Then again, pinch your nose and hold for 5 seconds. Then you release, and then you breathe normally for 10 to 15 seconds and keep on repeating that for 5 minutes. Now what's happening is there is another very important aspect is, when you are having these small breath holds again and again and again, it helps us in opening up of the lungs, right? It helps up in the opening up of your lungs. It helps you, into terms of oxygen, better oxygen delivery to the lungs. How it happens, it's a little more detailed discussion, which we do it into our sessions. But yes, this is one of the basic exercise which helps you in opening up of the lungs. So whenever you feel that you are gonna do some work, you can always, you know, always you can use this. Okay, this technique. So this is a brilliant and excellent technique to make you understand. So we have launched our workshops, Oxygen Advantage, and the next session will be starting from 1st of July. So workshop is totally divided into 10 intensive sessions, around 3 sessions per week. Each session covers a theory and a practical exercises of Oxygen Advantage. The one which I have shared with you, it's a basic exercises. There are around 30 exercises which are very, very different from the beginner level to the advanced level. Each session is of a 1 hour duration, and a pre-workshop analysis will be done for each participant, and session will be conducted on alternative days so that the participants understand, learn, and practice. There is a support group which has been created. The session is starting from 1st of July. Anyone of you who would like to join this session, we are having a special rate. Those who are listening, if you can contact by tomorrow on our helpline number, there is a special rate of 1999 rupees inclusive of GST. So please call on 6351580588 or write a mail to support@silence.com for availing this offer. This is a very exclusive offer for only those who have been watching this. So if you are interested in realizing your potential in terms of making yourself a wonderful human being and realizing your potential, getting the best of the Oxygen Advantage program, breathing nicely, and getting that competitive advantage which very few have got. So join today this Oxygen Advantage program. It will help you in terms of performance as well as making your life a difference. And one thing I can promise you, one thing I surely promise you, these 10 sessions will change your life for sure. It's 100% money back guarantee, right? If you feel that it's not change your life, you will return 100% of your money. I can promise you that. But this program, once you do it, it's 100% money back guarantee for you. You must join this program because that I personally feel when I did this program, I learned these techniques, I do that. It's like an expanding and entering into a different realm of your potential. So please do that. And for any query, call our helpline number 6351580588 or write to us at support@sirens.com, and we'll be more than happy to answer any of your query. I hope you have enjoyed this beautiful, just a small introductory session and learned a few key exercises, which are the very key to this. And I hope to see you soon in our sessions, which will be an excellent way to begin and realize your potential. Take care of yourself, and I'm Coach Rahul Sharma. I'm always there with you for any assistance, any help. All the best. Thank you very much.